Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me today is Jodi Clements from Chosen to Care Medical Centre, and today we're talking all about women's health. Welcome to the show, my friend. Nice to see you again. I want to talk to you a little bit about what type of women's health visits do you and Tiffany enjoy doing the most?
So we see all of the women's health visits, such as annuals, pap smears, screenings for, we do referrals for mammograms. Yeah. We also do the acute STD testing and treatment, as well as the urinary tract infections, those type of visits as well.
What are you most passionate about when it comes to women's health?
Oh, wow. Postpartum is my most passionate area, and that's anxiety and depression that is seen that's often untreated.
Talk to me a little bit about that. Give me a little bit more of a in-depth look that if these women are sitting at home that are undiagnosed, what are some of the signs that they may be feeling before they're coming to see you?
Okay, so what really stuck out to me with postpartum anxiety and depression is a statistic I saw several years ago. And that was that 60% of those that commit suicide postpartum do not see a healthcare provider in the month before their suicide.
Really?
And that just really struck me in that that's an area that I had to start seeing. So these patients typically do not come in due to denial or fear of that stigma that's associated with mental illness. Symptoms such as lack of bonding with their infant, fatigue, the anxiety symptoms such as palpitations, sweating, nervousness, also just some OCD tendencies as well. So that overall sense of dread and fear are the typical symptoms, which are hard to identify postpartum.
Well, I was going to say, as a man who has no children, okay, and I've done a lot of conversations along these lines, is that having some of those symptoms also make you feel you're a bad mother.
Yes.
So that's on top of everything else. And it's not that you're a bad mother, you just need some help.
Absolutely.
And I do find that women, and this is not a negative at all, feel like if they reach out that they're failing.
Failures. Absolutely.
So what can you say to those women sitting at home right now that may be feeling that way? Because they're not failures.
Not at all. And that's the thing. That's the biggest thing, is seek help. We are here to help. And we have conversations in depth. And I gauge the conversation patient-based,
right,
of how long we need to talk, if referral to therapy or counseling is needed.
Of course, I didn't think of that.
Alongside of medication management. So we take the overall picture and really try to formulate it patient-based.
Okay, so I want to walk through my first visit with you, if I can.
Absolutely.
As a woman who's just had a baby, which I know I can't, but we can have that conversation.
Yes.
So explain to me what that process would look like if I was to come to you after that first phone call.
After the first phone call. So, and that's the thing too, most people when they call, they won't say that it's directly for postpartum anxiety or depression. They may just say fatigue, or I don't feel like myself, or something's wrong.
Oh, okay.
Or they'll say, hey, I want to get an annual wellness visit. It's really our job, once we go into that room with the patient, to dig that out of them most of the time. And even just body language, often I can tell, and I just try to always hit that topic and say, you know, what about your mental health? How do you feel? How have you adjusted to becoming a mother? That's typically when they start leading into those symptoms they're having, and I can help bring that to light, that there is actually an illness going along. So
really? Now, when you're discussing those type of illnesses, I know prescription over-the-counter drugs aren't for everyone. Like you said, you may just need some counselling, some one-on-one help, maybe some time for yourself.
Absolutely.
And that's what I find a lot of new mothers don't get, is time for themselves. What are you saying to those people that are saying, I'm just exhausted, I just can't do this?
So I have twins that are 4 and an 8-month-old baby girl. So I feel very passionate about that, and I just kind of relate to them, and that is all the medicine they need sometimes.
It's relationships.
It is. Absolutely.
We appreciate you. What a great idea. Thank you so much. If you want to find out more information, there it all is up on the screen for you. Chosen to Care Medical Centre, and we've been talking all about women's health today. Back after this short break.